Okay, hello everyone. My name is Natasha Dean and this is Brittany Martin. We are both students of the Southern University Speech Language Pathology program, and today we will be talking about specific language impairments. A specific language impairment, also known as a SLI, is a communication disorder that is present despite other normal development. It is an impairment that is diagnosed when a child's language development is deficient for no obvious reason. There's no comorbidities, otherwise known as like underlying medical conditions that contribute to identification of a SLI. Excuse me. Speech language pathologists typically determine the child's developmental status when they compare it to another child's results, and they do it in terms of age. In speech language pathology, age is kind of broken down into 3 different categories. So you have your mental age, which is where the level that the child is functioning cognitively. You also have the chronological age, which is the age of the person that's measured by birth. So like a 7-year-old, 6-year-old. And then you also have the language age, is the point of language development in which the child has reached. When determining a child's mental, chronological, and language age, they also, it's further determined if it falls under normal variation. Can you go to the next slide?
Yes, I did.
Oh, that's the one I just read.
Oh, I'm so sorry. Okay. All right, so we're going to talk a little bit about the prevalence of specific language impairments. This is the rate at which language develops, and it is typically individualized to the child because some children tend to acquire language at different paces, while others may have an abnormal development as far as maybe they lag behind and then later on catch up appropriately, while some may start off at an appropriate rate but then eventually begin to be delayed. So due to this, different prevalence figures are seen, and they are affected by what or how we are using or measuring language. So SLIs are one of the most common developmental disorders, and it typically affects about 7 to 8% of children in kindergarten. Some of the characteristics that are associated with SLIs, some of the common things would be maybe like literacy, academic difficulties or limitations. The child may have environmental language and learning limitations. They may experience some problems with social, developmental, or psychosocial adaptation issues. And then there's also some genetic transmission that can occur with SLIs. From an educational standpoint of the school children, the standard has taken root in the requirement that impairments need to have negative academic impact for a child to even receive services in schools for SLI. Because additionally, the children may use like a substantially higher number of words without clear reference, such as thing, this, that, here, and there. So some interventions or treatments that can happen to kind of better help the developmental process of an SLI, it kind of can start with either direct intervention or indirect intervention. Direct intervention meaning that this is a one-on-one type of interaction, maybe with the speech pathologist as well as the child. Then you may have individual sessions or group therapy. Group therapy is kind of the more appropriate setting if the child needs to have more peer conversation or interaction. And on the other end, you have indirect intervention. This is a collaboration of assessments from your speech language pathologist and then, of course, other environments the child is around. Parents and caregivers are more involved with this type of intervention because they help create and enhance the child's language environment, and they kind of get the chance to be a little more hands-on with their developmental process. And then going to a school setting like preschool, it allows the child to gain a higher social interaction with their peers. And so in conclusion, specific language impairments, it's a lifelong impairment or what we consider a chronic impairment. However, it can be managed through therapy. And the important thing to understand is that if your child does appear to have delays in their language acquisition and just their developmental process in general, it is great to seek a consultation from a speech therapist or even your child's pediatrician to get further information on how to better handle or go about this situation. Here we've included our references.
Okay, and then we also kind of have just kind of 3 questions that could possibly come about after seeing this presentation. So the first question that might be common is a specific language impairment a lifelong condition? The answer to that will be SLI is a developmental disorder that is typically appears in childhood. As the child grows into adulthood, the impairment isn't cured, but developmental strategies can help manage the symptoms. My second question is specific language impairment the same thing as a learning disability? A specific language impairment is not the same thing as learning disability. SLIs are considered a risk factor to a child's language development, being that problems with basic language skills can affect classroom performances. And the last question, how can I receive more information regarding specific language impairments? You can receive more information regarding specific language impairments from speech language pathologists. They are competent in understanding this particular condition. Also, you could do research from different websites, scholarly websites, such as Center for Disease Control and Prevention and the American Speech Language Hearing Association. All right, and thank you for watching.
Thank you.